on self-check examination for the breast. Dr. Sparman, if you can walk us through. Drayton, if you can bring that up, the number 2. I think you're muted, Arnell. I'm not hearing you.
Okay, you hear me now?
Yes.
Right. So this is a diagram showing the steps that we would take for the breast self-examination. Um, Let me just begin by saying that this um, breast examination, it works best when combined with your regular clinical examination and screening, right? So this is like the first layer of detection, but by
Mhm.
no means does it replace, your regular clinical examination by a physician, and of course, further screening. Um, it is recommended for us to do the breast self-examination about a week after the menstrual period. And for those women who do not have a period, um, to choose one day, the same day every month, to do this examination. It's recommended to do it once monthly. And so the first thing is you inspect or you look before you touch your breast. You would look before you feel. Um, you can stand in front of a mirror with your shoulders down, your arms to the side, and you observe. So some of the things that we observe for you, and some I would have mentioned when I spoke earlier about, some of the signs of breast cancer. Some of the things you look for, the changes in your the size and the shape of the breast. You
Mhm.
observe to see if there's any dimpling or puckering on the skin. You look to see if there's any redness or scaling over the nipples.
Mhm.
Um, you look to see if observe the nipples to see if there's any inversion or if it looks different from what your nipple normally is. Not all inverted nipples mean, that we are concerned about breast cancer. There are persons who normally have inverted nipples.
Okay.
But of course, if this is something that you notice is new, right? And of course, as we mentioned, you would look to see if you're seeing any discharge from your nipples. And then we move to observe or inspection, right? And it is recommended that you do this um, either lying down, lying flat, and it's also recommended that you would palpate or do your touch your breast and inspect and feel your breast in the shower. Some women prefer to do it this way because it's you have the soap and it's kind of smooth and easy to move over the surface of the breast. So you use the pad of your fingers, or the tip of your fingers, the pad of it, and you move in slow small circular motions, and you want to cover the entire surface area of the breast, right? So from top to bottom, side to side, with light, medium, and deep pressure. All right. It's important that you also do not forget palpating or feeling under the armpits. And the reason why it's important for us to do that is because one of the first places that the malignant cells spread to outside of the actual source, or the primary area, it would be to your lymph nodes. And the lymph nodes under the in the armpits are the first ones that become involved, um, if there is breast cancer and it has spread.
Ooh.
It's usually the first place that it spreads to. So it's important to include um, examination of your armpit area. And
Wow.
so what you checking for? Again, you're checking for new lumps. Um, you're checking to see if there's any swelling on the breast tissue itself or on your arm. And you're checking to see for if there's any unusual tenderness that doesn't go away. You know, when I was in medical school, just as a side point, um, we were taught that when a swelling on the breast is painful, it's less likely to be cancerous, right? But it doesn't mean that once it's painful, it's not. But when it's painful, it's less likely. Um,
Mm.
breast cancer lumps are usually those small, discrete, painless swellings, as I would
Mm.
have mentioned earlier. And so, with that said, you know, those are the areas that we would first inspect and then we palpate. And it's the same maneuvers that you would do in the shower. You wanna examine the entire surface area or examine the entire surface area of your breast. All right. You want to know what is normal because many normal breasts have lumps. Not all um, not all lumps in the breast means that it's
Cancer.
cancerous. They are benign masses in the breast. They are, you can have an abscess to the breast. You can have a mom who is breastfeeding. And for all of the mothers who are on the panel and who are listening would know that, your breast can be very tender. And when it's engorged, you can feel it lumps and bumps there in your breast in breastfeeding months. So not all lumps mean that it's cancerous, but all lumps need to be investigated. And it's important for you to know what normally your breast looks and feels like, so that if anything new is noticed or it's persistent or different for you, you'll be able to, get it checked out.
Okay.
Right.
Yes. So I have one more question for you. Before we go to Miss Jacobson, what would you say to women who have the fear and they're afraid of the discomfort in doing breast examinations like the mammograms because they have to put it in this thing and they get it so flat, and a lot of women who don't have a lot of breasts complain about the discomfort. And of recent I had one of my friends saying that, oh, I'm not going back and get a breast examination, which is, not a good thing to do. So, what is the advice about that?
Um, that's a genuine complaint by women who would have had mammograms done. Because it's quite not a pleasant thing to experience or have to do, as with a lot of things that we have to do as women. But you have to think about, the benefits and the importance of early detection and so on. So it's a genuine concern. It is a complaint that I've heard numerous times from numerous women. Uh, but it's something that we have to do to take care of our health. All right. So my advice would be, don't make the fear of your breast being squeezed uh, deter you from looking after your health. All right. It's just a minor thing. As women, we are strong. So don't let some discomfort from a mammogram prevent you from potentially discovering something that can be can be treated in a timely manner. But outside of that, a lot of women I find experience genuine fear and phobia when it comes to breast cancer. And I think it can show up, this fear can show up as avoidance
Okay.
completely. You know, they want to avoid self-examination. And let me tell you, when I do my self-examination, there's always this fear that I'm going to find something. There's always that fear. I don't know if the other women on the panel and experience that. I don't know if it's because I'm a doctor and I would have had more experience seeing persons battling it and so on. But there's always this genuine fear that I'm gonna find something.
Mm.
And you know, they some women avoid it completely, avoid the self-examination, skip screening, delay doctor's visits. And it's not because they don't care or not because we don't care, but there's that genuine fear of if you find something. All right.
Yeah.
Um, there's also that anxiety if you find something, you would have had an experience with family members or friends who um had to go through chemotherapy and you see them losing their hair and all these body changes that is certainly overwhelming. And then we can't run away from the cultural aspect of things. Not all in all communities and cultures they openly discuss their breasts and they're open with them feeling their own breasts or going to somebody to feel the breast. They feel embarrassed, like it's something taboo. And then there might be those with past experiences with persons who would have unfortunately passed away from it, and so that there's a genuine fear. But I just want to put it out there today that for all of us, fear should not be a barrier to action. All right, because the bottom line is early detection equates to more treatment options and it equates to better outcomes. All right, so that would be my 2 cents in that regard.
Thank you very much, Dr. Sparman. And as you know, we have a woman's advocate on the panel as well. And I want to let the audience know that when we speak about women's health, and this is in keeping, this is the last Saturday in the month of March. And so we're trying to keep in the theme of Women's Month. And so when we're talking about women's health, it's not only the physical, but we have other aspects. And so Miss Jacobson will shed some light on that for us now before we go on to another aspect or another form of women's health that is critical for us.
Absolutely. Thank you so much for having me here again. I would like to, in addition, add to what Dr. Spearman stated overall about cancer, breast cancer, the suffering of women, and what we go through on a daily basis. We go through a whole lot, and like Dr. Spearman said, it is imperative for us to do our monthly checkups, so on and so forth. But what I want to touch base on the fact of being an advocate for women, I want to touch an area that some people usually do not like to touch that area, because in that area comes a lot of health issues between us women, and not only women, our children as well, and usually our female children suffer. So what I want to discuss about is domestic violence that leads to a tremendous amount of women suffering. Here in America, 1 in 3 women suffer from some sort of domestic violence, whether it's physical, emotional, mental, monitorial, like I stated. So this leads to health issues. you may find that in our system here in America and worldwide, we have cases like 19,000 cases per day in America, which leads to 20 women in a minute that uses the hotline, whether it's domestic violence or 911. So here are some of the issues that leads to health issues that leads to or stem from domestic violence. Women tend to develop heart attack as well from being a victim, being victimized by their spouse, significant other, whoever that they are in a relationship with and is or did experience domestic violence. So domestic violence really harm our body overall health wise. Many people do not like to discuss about this, but it is very prevalent. It is serious, from having to deal with stroke, heart attack, cancer, gas, gastrointestinal disease. You deal with, like, because of the stress, the anxiety, the
Mhm.
puking. It comes with a whole lot of health issues. So, as a panel here and educators, we want to spread awareness that health issues do not stem only from the medical aspect of it. Like, you wake up today, that, like Dr. Spearman stated, that you can all of a sudden be diagnosed with breast cancer, but it's up to us to self examine ourselves, so on and so forth, to prevent this. But what about the women who are in a silence, us it is in silence in their home with their mate and with their spouse? Even during the coronavirus, more women suffered around the world from domestic violence. More
Mhm.
children was in the emergency room with broken bone, this, that, and the other. Some people swept it under the carpet. So we have to address these type of issues because it brings along health issues that sometimes leads to our us losing our life. The
Mhm.
dealing with domestic violence, sometimes women victims develop suicidal issues.
Tendencies. Mhm.
So we must spread awareness about this because we have women, like I said, they are in silence. They don't want to talk about it. They don't want to seek help. But I'm saying today, we are saying today, if you are experiencing any kind of domestic violence that leads to health issue or unlivable situation that you yourself cannot deal with, I know when we get married, we connect together. It says, until death do us apart.
Right.
No,
Mhm.
it's not really that. If you have to make decision to seek help, speak to your medical doctor, speak to a nurse, go and get you some sort of counseling so you can start changing around the dynamics of how you accept domestic violence so you, in retrospect, do not have to suffer with health issues.
Wonderful. Yes, wonderful. As I said before, domestic violence is another very, very important thing that is plaguing our women, and it's very, very important to our mental health. When
Yes.
when we are in domestic violence relationships, sorry, we find ourselves studying all sorts of things. We're studying how we're gonna, how we're gonna live if we leave this relationship, what's gonna happen to the kids, and all sorts of things we start to put in our head. And when we get worrisome, it brings on other health factors. It brings on other health things to plague our bodies. So they're all interconnected. There's nothing that is all separate, that we say, oh, mental is separate from physical. They're all intertwined, right? And so the next one that I wanted to for us to touch on, because this one is also plaguing our women, and we are not even handling it as we should. I have been looking up at the statistics, and I did ask Dr. Sparman about it and so forth, is cervical cancer. And it seems to be really ripping through us now. And like, I'm trying to figure out what was happening different long ago to now, that it's so prevalent, that it's so abundant. It's like all over. Like, we had years ago, those ladies would have done their um nice little treatments at home and all these fancy things, and they use their old time napkins and all these things. We all have our fancy thing, tampon, pads, sanitary napkins, whatever we want to call them. And now we're being plagued with cervical cancer. So I'm trying to find out if there's any connection with us using all these products and all these things with all these chemicals in them and so forth. So over to you again, Dr. Sparman. I will ask the panel just now if they have any more questions for you, but what is your opinion on cervical cancer?
Okay, so cervical cancer is one of the cancers that we know the cause. There are many types of cancers that we don't know what's the cause, but cervical cancer is different in that regard because we do know that it is associated, most of the cervical cancers are associated with a virus we call human papilloma virus.
Okay.
And if you guys have teenage or preteen kids, you would know that the HPV vaccine is one that is being introduced in that population of kids, right? Before, and the aim is to protect them or have them develop immunity against the virus by way of vaccines. It's aimed to give them that immunity before they become sexually active, so as to protect them. So it is one of the cancers that we know the cause, or one of the main culprits of that causes it. And it is one of the cancers that if we detect it early, it is treatable. All right. I'm not sure about associations with, or feminine hygiene products and so on with it. I'm not familiar with that. I'm not sure if there are any studies out there that have shown associations with it, but I am not familiar with it at this time. But cervical cancer, it is preventable, and when it is diagnosed, it's at least in the early stages, it is treatable. So this is at this stage. I think with the introduction of the vaccine, of the HPV vaccine, we should see some decrease in the incidence and prevalence of cervical cancer later on. But for now, again, screening again, the take home point, you do your pap smear as recommended by your physician, and so that it can be detected. Any abnormal cells can be detected there, and it can be treated. It can be treated appropriately.
The HPV virus, is it not only sexually transmitted? Because I know they say that it can be transferred through genital areas and so forth, but can it also be transferred via other means?
That's the main way in which it is transmitted, and it goes back to the risk factors of cervical cancer. Some of the risk factors would be having multiple sexual partners. If you have, starting to have sexual activity at an earlier age, if you have a partner that is promiscuous and have your partner has multiple partners, that can put you at risk. So it is mainly sexually transmitted.
Mm. I see a question in the chat, and the person is asking, does Kabbalic soap for women personal hygiene, is it useful? Because I remember a little girl growing up, everybody talking about you use Kabbalic soap or you use a little Dettol in your water and all of that.
Well, I am not an expert at what types of soaps and so on. I also grew up with a grandmother and a mother who believed in a little Dettol in the water to kill whatever bacteria. I myself don't exactly do that right now, but your regular soap and gentle soap and water should be able to, you know, have down there nice and clean. You don't want to kill all the good flora down there and, getting rid of your bacteria. But just, so I'm not sure about the carbolic soap, but I know your regular gentle soap, you don't want to use so much of harsh products down there. You want your good normal flora, keeping the good bacteria is down there to do its job also. You don't want to kill all the bacteria. You want to just kill a bad one. So I guess regular soap and water can do the trick. I'm not sure about the carbolic soap.
Yes, Leslyn, do you have a question for Dr. Sperman?
No, I don't. I don't. She's pretty much answering what I wanted to ask about this.
May I ask?
Okay.
Good afternoon. Good afternoon, Dr. Spurman. I'm happy to have you. I'm learning a lot. I'm sitting here, I smile sometimes. I don't want to smile because I had to laugh just now hearing a few things. Well, my question is, earlier you mentioned that men have breast cancer, and that's something I've never heard about. Can you shine some light, please?
So men have a pair of breasts, just like women. Just that we have, the glands and so on that engorges for lactation and for breastfeeding and whatnot. But those two muscles that you have in front of you that you go to gym and those are your breasts. So men have breasts also. I'm not too familiar about the statistics. Of course, it's not as common as women. I'm not sure why, whether it has something to do with genetics or so on, but you do have a pair of breasts and they are also at risk of getting breast cancer.
Dr.
Yes, Ms. Jacobson, have a question for you, Ms. Dr. Sperman.
I wanted to ask you in addition, does female in the family of maybe a mother who was diagnosed with breast cancer, does the daughters themselves too may suffer from breast cancer as well?
That is one of the risk factors that will put a person in as a high risk or considered high risk. If you have a first degree relative with breast cancer, so you'd find if that's the case, it would be recommended most of the time. So your physician would recommend that you start screening earlier. Usually we start the screening or the mammograms at 40 years, but it can be push back 10 years or sooner. So your physician might more than likely would encourage you to start your mammograms and clinical screening as early as 30 years if you have, let's say, a mom or um, an aunt or so who would have had breast cancer. So it does put you at a higher risk of developing breast cancer.
Thank you. Thank you.
Dr. Sparman, what are some of the symptoms we can look for in cervical cancer? Because I read that some of the symptoms they resemble like menopause or endometriosis. So, what are some of the symptoms that we can look for? And like, is there a detection that we can say, oh, is this or not that, or we definitely need to go check it out?
So symptoms of signs of cervical cancer, it usually presents with like vaginal bleeding, particularly after sex. Of course, abnormal bleeding outside of your normal menstrual period. Um, you can have pelvic pain, severe pelvic pain, and unusual discharge, right? So those are usually the signs of cervical cancer. Um, Although we have some of the symptoms overlapping with, you know, the symptoms that you would see in cervical cancer, some of it you would see in menopause and PCOS and those sort of things. Although the symptoms overlap, they're not the same, and they can be they can be easily differentiated, right? And that's the job. That's our job as physicians. Your job is, as patients, is to recognize that something is wrong. Either it's irregular bleeding, um, heavy bleeding, pelvic pain, changes in your menstrual cycle, um, you know, very painful sex or bleeding after intercourse. Your job is to recognize that those things are abnormal or something is off, and so make sure that you go to your physician to check it out. Menopause, for example, it's not a disease. It's a natural stage of life, right? And um, usually you would have your hot flashes and your night sweats and so on with it. So those symptoms, it can easily be differentiated. And of course, we have our investigations that we would do to differentiate one from another, despite the fact that the symptoms overlap.
Okay. Okay. What besides the fact that we go for our pap smear and get our HPV vaccine, what are some other things that we could be doing at home? Is there any like practices that we should be taking into consideration? Like about I was told that sometimes we might be using products that, like, for example, I was told that if you're wearing different forms of underwear, it can cause a reaction down there and change like your pH. And so that might throw off and you might get a discharge. And you might be thinking that that might be a discharge because something is wrong. How is it that you can say, oh, this might not be something wrong, but, you know, it might not be cancer. It could be just regular off balance bacteria or something like that?
Um, my answer to that question would be to advise folks not to be your own physician. Don't be
Mhm.
Dr. Google. Don't go to Dr. Google. if you think that something is going on with you down there, or any part of your body that is
Mhm.
abnormal or that you are concerned about, don't go try looking, oh, it might be this, it might be that. If you're uncomfortable with it or you have any doubts, just go to your medical, go to your physician. That's why that's why we study to, take all that stress away from you. We are gonna figure
Yeah.
things out,
Yep.
right?
Yep.
Dr. Hello?
Go, Doctor. Go, Miss Jacobson. Doctor
Yeah,
Sparkman is listening.
I just wanted to ask Dr. Spearman, like, what is your take on the fact that over 10 million women and children suffer each year in America? And like I said, every 9 seconds around the world, a child or a woman suffers as well. Like, what would you say or advise? Let's say if your patient came into your office and it's not in the realm of that knowledge, like what they came for, but because they are under so much stress, like I mentioned before, if they brought up the issue that they are suffering from severe domestic violence, what would you recommend for them?
Well, I can speak to our protocol at the institutions that I work here in Ghana.
Yeah.
We would definitely engage our social worker departments, and they would take it from there. But the first step is always to listen to your patients, make them comfortable with you, because things like domestic violence, people try to hide it from even family and close friends. Um, but I find a lot of times they are a bit comfortable with your physician, and of course it's the interaction that you have with them and how comfortable you make them feel at the visit. Um, and so I'm big on listening to my patients and parents, because as I said, I'm a pediatrician, so I have to deal with both parties. Um, and I've realized that social issues play such a big role in, you know, everything, the general health of the patient,
Yes.
you know. Um, but it's so overwhelming that I have to make a conscious decision and a conscious effort to, like, not take it on too much. So, I always get my social worker involved and on top of things, and take it from there.
Well, that's the first in retrospect, because it stems with you dealing with the mind. You are dealing with what a person is experiencing at that time, and when they are dealing with domestic violence, harsh domestic violence is domestic violence, no matter how you look at it. But women tend to sweep it under the carpet because they feel shameful, they feel embarrassment, and they don't want to talk about it because they usually think that someone is going to put them down or blame them for the fact that they have experienced harsh domestic violence. So this is where we come in as the voices, as the leaders in society, when we spread awareness. And like you said, it's a sensitive issue, so you would have to know how to approach it. But we are responsible for helping building our women to have a better way of life and to be safe, to be very safe. Sometimes we would say you can do better by yourself rather to be in an environment that is causing you so much pain and suffering, anxiety, depression, like I said, losing weight, women are not able to sleep properly. This is a factor in life. And like I said, right here in America, 10 million women suffer every year. Later on, I want to do a study about the Caribbean because domestic violence is very prevalent in the Caribbean as well. And you will find that one or more children will suffer during the experiences of dealing with domestic violence in a home from age 7 to 10, usually. Those children develop poor ability, like their equilibrium is stumped because they have been seeing this domestic violence in their home, that they shelter themselves and their minds stop growing.
Yes. Winston, do you have a question for the panelists?
Not right now.
Leslin?
I wanna well, the thing about domestic violence, I want to touch on domestic violence at this time because I can go down a rabbit hole if I really get to talking about domestic violence because it is so prevalent in our society today. So I'm not gonna go in the route of domestic violence. My big thing is about women taking care of their bodies. I know you guys were talking about cervical and breast cancer. There is a simple thing like STI. A UTI, I'm sorry. There's yeast infection. There's what is it? They have some women walking around smelling like skunks. And that's because I feel like they don't have the guidance that they need. They didn't or don't have the guidance that is needed. We have all of these little hot girls around the place and they don't know how to brush their teeth.
Mm.
We have them walking around with creamy teeth. We have them walking around smelling bad. And they're well-dressed. You understand? We have women in our society who has never taken a pap smear. They don't understand that the skunking smell that is coming from between their legs is because of the fact that they're not taking the opportunity to go get themselves checked. A pap smear is something that you should get done, doc, every 6 months to a year? A mammogram is something that I don't care how much pain it is. I don't care how much it hurt. It's not going to kill you. I get a mammogram done every year. It is not going to kill you. It is going to save your life. I'm being very stern at this time. You have to go get a mammogram done yearly. Too many of our women are dying immediately as soon as they find out that they got cancer. They have people finding out they have cancer at stage 4. Do you know how many things you have to go through to get to stage 4 cancer? How are you living your life not checking up on yourself? And you find out you have stage 3 and stage 4 cancer. That is the last stage. You have to, I beg of you, women, girls, men, mothers, fathers, everybody, go get yourself regularly checked. You have to go get yourself checked. We are losing people in their 30s and 40s because they didn't know that they had cancer. We're losing these people because they didn't know they were diabetic. We're losing people because they didn't know that they had a tumor in the brain. We are losing people it left, right, and center. People are not living to 50, 60, 70 and the golden years because they're not taking care of themselves. Back in the day, and the thing is, we have people who are alive who are 100 and something years old. We are not living in the 50s, 60s, and 70s. And those people lasted long because, of course, they took care of themselves. They take the necessary bush and the home remedies and all of these things. But we have people who are not doing that at this time. And they are dying on us. We are losing our people in our community. How is it Guyana don't have 1 million people? I was a child when I found out that Guyana had 800 and something thousand. We still at 800 and something thousand. We are losing people. People are dying on us because they're not taking time to go get themselves checked. A little thing as your teeth. I had riders in my mouth all over. Don't worry, this here's something my ex-husband punched me in my face and knocked his teeth out. This domestic violence. We're talking about that's why I said about the rabbit hole. I had writers all over my mouth because as a kid coming up, my mother didn't take me to the dentist to get myself my the only time you used to go to the dentist is to pull out the teeth in the dental school place there, and you used to have to go from 4 o'clock in the morning so you could get to go in. The line used to be long wrap around the corner. That's how I grew up in Guyana. That's what it was. We are not there anymore. We are not there anymore. We have a plethora of dentists available all over the place. We live in the US. You get your insurance. You go take care of things. Clean your teeth every month. Take those, not every month, I'm sorry. Take those babies to get the mouth clean every 6 months. It's a little thing like that. Teach the young ladies how to take care of themselves. Put on a panty liner. Teach them how to smell, to make sure they smell. Teach them things like that. When these kids hit puberty, they got to smell like a skunk. Teach your children how to take care of their bodies, how to know when something is wrong. How are you walking around with a headache for 5 months? And oh God, look, I got a headache. My head hurts me, I get a migraine. How do you know you have a migraine? Are you a doctor? Did the doctor tell you have a migraine? Oh Lord, me back hurting me. I think I strained myself. How you know that? Did the doctor tell you that? People are going to the doctor and find out they got high blood pressure. One time. My whole life, I was a dancer, an actress, very, very active person. I came to the US. I started getting headaches. I went to the doctor. Boom. My blood pressure is 190 over 150. I started taking medication. I'm fine now. I'm saying this. You have to go take care of yourselves. I know they have people who are living in toxic homes who are suffering from domestic violence, like the beautiful lady said, and they don't have time to take care of themselves because all they're thinking about is survival. You're not going to survive if you don't go get yourself checked. You're already in a mental state where you cannot function. You have to take care of yourselves, people. I am begging you. We're losing brilliant, brilliant women and men and young people because they're not taking care of themselves. They're not going to get checked. Every woman, once you reach a certain age, you should know how to check yourself. You should know. You see that diagram Drayton just put up? You should know that you should put your hands up and you feel. You should know when you have a BV. And it doesn't only just come from underwear. Some people are allergic to latex. Some people are sleeping with one person who's sleeping with 5 people, and that's how they get BV. And you don't know it's BV because you think they're supposed to smell like that. No. How do we have young girls out here bathing with soap and washing their private area with soap? And then they don't know that you're not supposed to do that? We are living in a time where all of this stuff is available on Google and it's free. I'm not saying, like the good doctor said, don't go to Dr. Google, but you can go to Google to learn things about yourselves. Absolutely. Sit down and talk to your young ladies. Sit down and talk to the young men about certain things about their bodies and the changes that is happening. We should all get checked every year. There's no excuse. There's no exception. I don't want to hear, oh, I work hard. Really? I know somebody who worked, a cousin of mine, his best friend worked for 60, how much years in the US. He finally retired and he went home to enjoy his retirement and he died a week later.
It happens. Yeah.
Mm-hmm.
You know why? Because he was not paying attention. Brain aneurysm, boom, dead. That's it, gone. Because he worked so hard all his life, he want to enjoy his life as work hard. Working hard is not a flex. It's not something to glorify. Yeah, you got to get it done because you want a good life for you and your kids. But if you are not healthy, you are not going to enjoy that life with you, your wife, and your children. If you're not healthy, you're not going to enjoy your life with you, your husband, and your children, or even you. You can't go on a girl's trip because I working too hard. Don't do that. We have to take care of ourselves. And wives, husbands, hold on about the wives. Husbands, you have to be involved. Stop with this nonsense. I know fathers is good to the hospital with the children and don't have a clue. Where was the last flu shot? Where was the last vaccine? When last they get some medicine? When last they had this feeling? The fathers don't know that. Only the mothers know. Why aren't the husbands involved in the visits, the hospital visits? Why aren't men going to doctor's visits with their wives so that they can hear what's going on with her body? They're using that body.
Yes.
They're taking part in activities in that body.
Yeah.
So why are they not going to the visits so the doctor could tell them what's going on? You want to enjoy this body? You need to come find out what I need to do to keep this body going. You understand? You have to take care of yourself. Husbands and wives, you have to go as a couple, boyfriend and girlfriend, woman or man, whatever you want to call it, whatever, however your relationship is going. You have to go together. Fathers, take the time off to go to this doctor visit with your wives, with these children, so you know what's going on with your kids. We have to do better. We have to talk to our children. When I had my first menstrual cycle period, whatever you want to call it, my mother tell me, let me just let you know, don't have no sex, because then your belly can get big. But she didn't tell me that I could get an STI, I could get an STD, I could get a urinary tract infection, and all of these things. She didn't tell me though. All she tell me, now that you know, you cannot go and have intercourse because your belly can get big. We're not there anymore. I'm 50. That was 40 years ago. We are not there anymore. We have too many information available to us via the internet, via books, via all of these advocates. We have doctors, the pediatrician. She's somebody you could ask questions, because your kids don't stop going. Where the doctor left? At what age does a child stop going to a pediatrician? You understand? Mine is 13. He's still going to the pediatrician. And let me tell you something. I talk to my son so much. When we go to the pediatrician, nobody sit down and talk. He still say what's going on with him himself.
And that's wonderful, because
I don't have to tell him, hi, good afternoon. I sit down in a corner day. He's 13.
Yeah.
What's going on? Oh, he can tell you. And he starts to speak on his own. What is happening? When last he got his shot. He know what kind of shot he gets. All of these things. We have to teach our children, because there's so much information available. We are not there anymore. Come on. We have to take care of ourselves. We have to teach our children. We have to support each other in the relationship.
yes, because
Yes, Les.
I just want to add to that, as you eloquently stated, that charity begins at home. Absolutely. We must start in our environment where we built that family, so on and so forth. So we must partake in all aspect of what is available to make our lives a better life.
Healthier too.
Yeah.
Yes.
Healthier. The food, our food intake. Oh, hey, Cleveland. Cleveland is here with us. Hi, Cleveland.
Hi, Cleveland.
Yeah. Otis. Winston. Otis. Call you Otis. You are into your herbal stuff and that kind of stuff. What do you what is your suggestion that you can use at home to keep your immune system nice and tight? I mean, COVID came, look how many people we lost, because a lot of people don't feel that they need to take certain things. Some of us live on fast food, not me, I cook. Some of us live on fast food. So COVID came and it attacked so many people whose immune system is so weak. What do you suggest? Like, you know, you're into the herbs and that kind of stuff. Talk to us. What do you suggest? And do you go take your regular visits with your children and your wife or ex-wife or kids' mom and that kind of stuff? Did you partake in that? And then we're going to go to Cleveland right after. I want to hear from him too.
Cleveland have the floor or me? Anyways,
Apparently,
You
le-
first.
you name chemist.
You, sir.
you know, like I was saying, growing up, remember our parent, especially my parent, every Saturday morning, each of us have a certain amount of Senapad every Saturday morning. And detoxing is very important because we eat all this food now that is not healthy. It's not like back in the days we have all of these good food. We have GMOs and this food that is killing us.
Yeah.
So one of the most important thing is purging, like detox, because even right on the panel could ask us when last each of which one of us when last we detox and we eat fast food. Some of us love the McDonald's and wherever, and we don't ever detox. And detoxing is very important because
Mhm.
once you're eating and a lot of water, you drink a lot of water, and it helps. But for me now, in my little experience in my chemist business now, I find the soursop, not the soursop, the sapodilla leaves are very,
Mm.
very effective, you know. And the soursop leaf is to be drink like once or twice a week. And before I go further, I want to say to my sister A on the panel, Idris, I wish you all the best. We miss you. We love you. And I hope
Yes.
you're home. I hope you're home in your own bed. I hope
Yeah.
you're home in your own bed because I'm a very emotional young man, and seeing you yesterday, put out that picture, I don't like it. I don't want to see that. I want to see a healthy, agile,
Vibrant Idris.
vibrant, he
Yes.
just always smiling. When I first met her there at GG book signing, that smile, and she
Mm.
always in a corner reading and doing something, you know, I love you. And I told her today, I'm having soursop leaves and sarsaparilla for the
Yeah.
ladies.
Okay.
So it's like, and even you see the coconut water, but she
Oh,
was saying she don't.
that's a fashion.
Yeah, she don't have the. She said she have the only one in the box. I sent her a picture. I just passed the area where they sell. So you just you're gonna be getting your fresh coconut water from me soon,
Wonderful,
and that's very
wonderful.
important. You know, if you pass some with coconut water selling, not
Buy it.
buy it. It's $6 to one, but don't look at the money. Buy a
Mm.
coconut water.
Yeah.
Back home, we used to
Yeah.
drink the coconut water with steel drops. Quingan know what we talking about, you know. Yeah, but it's all about healthy eating. And as much as we have all of these GMOs, and we know that, let us use fruits that have seed.
Mm.
If you
Yeah.
pass a watermelon that cut and doesn't have seed, don't eat it.
Okay.
So these are some of the things that we have to get involved with. Healthy eating.
Healthy eating, yes. It goes
And
a long way.
the meat, right? You
Mhm.
go to the store to buy meat today.
Mhm.
There is that red meat in that freezer. It red like if the blood is right there, like it killed yesterday. How is it so red?
Solid.
Mm.
Don't eat it.
Mm.
My suggestion is, as much as there's a place in Brooklyn on Utica and Maple, they sell live bird. And
Mm.
if I want to eat chicken, I prefer go there and let them kill it. I see they kill it in front of me. I don't know if it grow, but still I see a bird walking, and I think that might be better to eat.
Yeah.
It might not be, but in my opinion, it's I prefer either. But when I go Guyana, right? You see them
Mm.
rooster, what we call falcock rooster, them thing. I got some friends, we will cook like 3 and 4 of them in brown stew or curry. That's healthy eating.
Yeah.
The fish, what they have here, the porgy and all these kind of fish what they have over here, I try to stay away from that. I prefer eat the bango mary and the butterfish that come from Guyana, where I know that this is a good fish.
Yeah.
Like today was split peas and fried fish.
That's it. A lot of people don't cook.
Oh, that's
A
a
lot
next
of
thing.
people don't cook. Home cooked meal, people don't understand. You cook your little veggies, your little belange, your little okra, your little cabbage, your little bora. People don't do that. That's how
Yeah.
that's what I do. I don't cook the big fancy big chicken and fries and thing. Me not for cook them thing. I ain't gonna lie. I can eat it from Gigi and the rest of y'all. But I can cook my regular little greens and things. But we have to eat healthier. My son, I can't get him to drink the Cenapod, so I buy the little Cenapod pill and give you that. That's how we do a little clean out with little bitters. I chew a little bit of aloe and so.
Let me
You
just
have
DJ
to.
Quinn, let me hear from
Uh,
you, DJ Quinn.
We
You're
can't hear you,
muted.
brother.
hello.
Not hearing you now.
How is it now?
Yeah, we hear you now.
Good. Happy Women History Month to you ladies. Great show so
Thank you.
far. I am stuck here and I got people going to be walking behind me because I'm at the airport. But when women are healthy, families are stronger.
Yes.
Communities are wiser. And when women are supported, nations rise. Let us break the silence, remove the stigma, and stand together because women's health is not just a private issue, it's a public priority. And we
Yes.
talked a lot about what I gathered is that some men might be presenting as being callous, not paying attention to their women's health.
Right.
But can I tell you, I know 2 women who died 6 months after they found out that they had cancer. Why?
Too
They didn't
late.
break it. They didn't break it to their husband. They didn't
They
allow their
kept it to
husband.
themselves.
They didn't allow their husband to check their breasts. A lot of women, because romance is so much out of the door these days, that women are not allowing men to fondle their breasts, to check on the breasts. Our Dr. Pearson needs to have a class to help men to help to test these breasts. You know, Leslie, give us some lessons so we know what to look for.
You have to know to
you know?
let her raise her hand and they go around.
And we'll
that
make good
kind of stuff.
relationships. It will help with
Yeah.
good relationships because if you pay attention like that, that means you know you show some interest.
That's what I'm
And
saying.
you save. My mom died 6 months after we learned, and every time we see her, she had a pain. Mommy, what happened? Nothing.
She limping.
When we did take her to the doctor, 6 months she had.
Oh man.
Another woman in Montserrat, she was hiding her breast, putting sock in the brassiere, hiding it from the husband. When he found out, I mean, it was oozing and all manner of stuff. And when he found out, Russia over there, too late.
Too late.
So I mean, I can take some of the blame for some of the men who are callous, but what happens to the woman's responsibility in sharing her medical condition with her husband and her family?
That's
I
true.
think it's a deprivation if people allow themselves to die without a family knowing that they could help them.
Yes.
I think they cheat us of themselves if we're not able to step in and help you live longer. If you're gonna die from something like you couldn't get cure for. I mean, I could give you some information bush, some carrying crow bush with some tizum and some Karila, and you could pour it out and do a lot of things, right? You know, I can tell you what to do, but if you don't say, or if you keep hiding, if you think it's private, oh, this is my body and whatever, how can we help you? So I'm
That's true.
representing the men who I know are not that very callous, but women are not allowing them to check their breasts or getting to know their personal health conditions. And
Because
so
closed
I
mouth
rest my
don't get
case.
fed.
That's
Yeah.
right. I rest my case.
And listen,
I-
my ex told me when I spoke about I'm going through menopause right now. And at that time I was perimenopausal. So I was as dry as the Sahara Desert down there. I went to my doctor. He suggested lubricant. And you know what the man said? I'm old school. I don't use that. He don't want a part of that. So what was I supposed to do then? Still give in? Should I still give in even though you understand what I'm saying? So that's why we have some women out there are not disclosing what's going on with them because they're living with selfish people who don't care whatever is going on. They got to get what they got to get. That's why I said earlier, husbands, go to these checkups with your wives because this is the body that you're enjoying as well. She's walking with this body, but as your wife, your partner, you're getting to enjoy it. So you should go and take the time to go on those visits. You understand? So that the doctor can speak to both of you to let you understand that this woman's body is changing and you guys have to go with the time. And this is what you're going to do because the body is changing. Women's body go through so many changes. We come out and then we sing and then the period and then we think and then we children and then we think and then we menopause and we go through all of this. And if you have a partner, you want that partner to go through it with you, because then what happens when you cannot supply them what they need, in the bedroom, because of the fact that you you don't have that drive anymore. Your body's changing so much. You don't want to be touched. Don't touch me. So if, as a husband, you go with your wife, then the doctor will explain to you, well, this is what's happening with her body. Sometimes she might be a little off. She don't want to be touched. Give her that moment. The little hot flashes. It's not that she don't want you to hug up, but her body is boiling from the inside. The doctor will not be able to explain that to you, because if I tell you, you don't believe me. You think I'm playing. You think I'm lying. You think I'm pretending. So if you come to the doctor with me, then you'll get to hear for yourself the doctor saying, yes, her body does feel like when the kettle is hot and boiling from the inside out. So give her that time. Let her deal with that. Her body is becoming so different. It is drying up. So this is something that you can use to help to lubricate, so that you can both still enjoy your bedroom activities. No, we're not having that. You understand?
Well, Les, I'm hoping that the pastors and the counselors who are counseling people who are planning to get married will add that into the curriculum.
Yeah.
That it's going to come a time where you will need to go to the doctor's office with your wife, and even if she says you need to stay in the lobby, no, I need to come in the room
You
with
need to come in.
because a lot of women do that too, right? And so, and as fathers and as men, we need to talk to our men and let them know that that is something that we need to follow all the way through. We need to follow through with that, because we're losing our women.
Yeah.
And
Yes.
every time they give us a pushback, we bow because we don't want an argument. We want a peaceful
No.
home, and so we need to insist on knowing. And I think that's where the problem is.
And that's sexy,
We got to realize,
No. That's so
We gotta
sexy when a man insists.
we got to realize too that we come from a culture where health and health awareness is not very prevalent, and also it is not enforced. In the US, children cannot come to school without getting their vaccines. They would be sent home if they do not have their vaccines. I know that for a fact, because we have to ensure that we're checking their health records and so forth. So it is we're in a system where it's more reinforced. We're in a system where it's more manageable and so forth. But in a culture like Guyana, where it's not reinforced, it's not something that they want to do, because they think about privacy, and they think about HIPAA laws not being in place to protect them and those kinds of things. Some of them already have their own anxiety in dealing with just going to get a test done, and having the fear of having something that they're not even telling their loved ones. So we definitely have to look for different avenues. Some of the homes, they're not accustomed to that. And I feel like I remembered when we were in school, we were taught sex education. There was actually a class that would teach us about our bodies and teach us how to groom ourselves and so on. All those things are not in school anymore. So definitely we need to look for different avenues. And a lot of the parents are not aware of what they need to do. Some of the parents have not gone to the doctor in a long time. They don't have insurance. Here in the US, if the parents don't have insurance, the school still provides a system of where they can get things done through the school system. You vision, you have a little checkup and all of that through the school. And there's a nurse in the school as well to see and observe certain things. But some of them, they're not in tune with these things. So we're really facing a big issue when it comes to health and the necessity of health, especially among women.
Yep.
And another thing that I wanted to point out before I bring up a comment I see in the chat is that we also need to take into consideration how our loved ones feel when we do not tell them our diagnosis. You know, it's like you're robbing them. You're taking away from them that comfort. You know, you're thinking that you're saving them and you're sparing them, but in a way, you're being selfish.
Yeah.
You know, and sometimes, and I heard this as a little girl. I don't know if it's true. I remember since growing up, my grandparents used to be playing music and stuff, and they're like, I'm hearing this Brother Bob music playing, and I'm like, who is this Bob Marley? Okay, he's an artist, whatever. And they're like, oh, Brother Bob Marley died, and like, I like, he's dead. Yeah, he's dead. And so on, how he died? Oh, he was diagnosed with diabetes or something like that, and one of his legs was kind of turning gangrene or whatever, and they said, okay, you can amputate the leg and save your life, and he chose not to. I don't know how fully factual it is, but I heard that, and I was like, really? Someone would actually choose that? Isn't that selfish for your family? Isn't that, like your family wants to spend more time with you? And that's one case that I know of. We have a panelist who speaks about her sister who never told them her diagnosis and stayed with them until her dying bed and never revealed that to them. So we really have to look at all sides of the coin, not just saying, oh, I get diagnosed with something, I'm not going to share it. It's very important to share. It can save you as well.
They teach you everything in school other than how to regulate your emotions and how to deal with your emotions and how to express yourself emotionally. Everything else they teach you. Well, they don't teach you sex education anymore and all that, but they don't teach you that. And that is something that we have to learn from home. We as parents, our parents, we grew up, you can't go and say, oh, certain things. Well, not me. Back then, before my time, certain things you couldn't go and tell your parents because they don't want to hear about it. We are not there anymore. We as parents, Kendra, you have young children. Me, I have just one. And even so, I open up myself to my nieces and nephews and friends, kids and stuff like that, to have them come and tell me certain things. I have children who would come and talk to me before they talk to their parents. And I say, okay, we'll go together. Or I give them the strength to go talk to their parents about certain things. We don't get taught that in school. They teach you maths, English, social studies, science, and language arts. They don't teach you how to regulate your emotions. I spoke only last night to Cleveland about this. That's why we have so many children crashing out and don't know how to express themselves a certain way other than screaming and crying and breaking up things and all of that. We have to start teaching our children how to regulate their emotions so that they can come and openly talk to you. Create a space so your children can come and speak to you openly and not, we talk about, where did you hear from? What is this? Like, for example, the information you got about Bob Marley, it was just part of the information. They didn't give you the whole thing. Yeah, he was playing soccer, he kicked, and he told Hottie for a minute, he ignored it, the next thing you know, he turned black, and you find out, I think it was cancer or diabetes or whatever, and then eventually they told him about cutting it off, and he did say no, which was true, but he didn't grow up in a time where he was allowed to express himself and feel like, yes, this can happen. You can live for your children. You have all these children. This can work. You can take off your toe and continue life. I know somebody who lost 7 out of the 10 toes and they're living life out here. So nice. Because they were, given the opportunity where they had the village that would talk to them. We have to talk to our children. Teach them how to regulate their emotions and how to speak on certain topics. Speak about their health. Speak about if they have a scratch on the butt and it's scratching. Look, mommy, look, this. Me son is coming and show me.
Too many hush topics, man. Too many hush topics.
Yeah. My son is coming, mommy, what's this? You see, what? Did you feel this? What's this? It's a bump, Ayuk. It's just a bump. Are you sure? Yes, it's a bump. Let's check it out. You have to open up to your children so they can come to you and speak on things, and we won't have people running out here trying to kill themselves because they don't feel like they have anybody they can talk to.
That's why
we don't have people suffering in silence because we say, Auntie, you smell so? What's that? Is you foot smelling so? Oh God, what's that? Instead, you say, oh my God, no, let's go. We gotta go check this out right now. We gotta go fix this right now. Let's go find out what it is. We don't have that.
That's why, so that's why churches, radio and schools and us in the homes, that's what we need to get back into that hush conversation. We need to get out and be more open about it.
Open up, open the door wide. Kendra, I know you probably have a relationship with your children, even though you have teenagers. And listen, teenagers are the hardest to deal with in this life. I don't know why they're so angry all the time, but I'm sure you would have a relationship with your children that they can come to you and talk to you about anything. We have to do that because it's so easy for them to run to the other side
And
where they're welcome.
yeah, that is true, Leslyn. The fact about it is that, like I'm going to reiterate myself, that we must spread awareness. We must educate our society of the true matters of how we deal with circumstances in our environment. And
Yes.
our children are very important. You know, the factor in life, parents became very busy. Yeah, like they don't have time to sit down with their children because parents have to go out and work, do this, do that, and they devices in their children hands as their company. But in retrospect, it's doing a lot of damages.
Yeah.
We have to get back to the old time days where we take the time out to, even at home, educate our own children. Do not count on the school environment only to educate our
Yeah. We are their first teachers.
Yes.
We are our children's first teachers.
children. So when we have that profound way about us, we will have children that come to us, like Leslyn said. Her son will come to her on a little bump to talk about a little bump. Our should feel free to come and speak with us pertains to anything that is matter to them. Yeah.
Yes.
Yep. That's the truth.
Definitely. I feel also that what you might know to be the norm of long ago is a little different now. But we got to realize long ago, the community raised the child. It's not that parents weren't working long ago. They were working long hours and all of that too, because a lot of times they made 10, 11, 12, 13, 15 children. You got to remember the community raised the child long ago. So if you're going down the road and Uncle so see you doing something, they could always pull you in line and so forth. And when Sunday reach and granny ain't going to church or mommy ain't going to church or whatever, auntie so from down the way coming to take you to church or take you to some converse class or so on. So in those days, the community raised the child. The community could look out. This is a different environment. This is where there are more rights. Children have rights. Humans have rights now. So you got to be circumspect about certain things, right? I wanted to share this comment that I saw. Angela McKee said, my husband listened to Dr. Oz and got a better understanding to when I was, what I was going through when I was in menopause. So she is actually saying that not even if you're not going with your wife, because sometimes the work schedule might not allow you to go with your wife and all of that, but you can actually edify yourself and so forth. So you can notice these signs in your spouse. It doesn't necessarily mean that you got to go with them, because sometimes your schedules don't align for you to go with each other, right? And then the next thing that I also want to bring to point is that we have a responsibility to ourselves, to not only look at ourselves, but also to ensure that our community is aware. It's not fair for you to be in this environment with your family and all of that. Something is up and you're not telling them. That is selfish. Even if you're thinking that you're sparing them, you're not sparing them, because when they lose you abruptly, that is worse than if they know what's going on. They can help you, they can provide assistance, right? And when Leslie spoke about mental health in school, in our days, there was not a specific class talking about how to deal with feelings and emotions and all of that. But now we have programs in place that every Friday, we speak to them about how they should behave. We speak to them about how to decompress, how to move from 10 to 1, and just understand their feelings. If you have something bothering you and you cannot express yourself at the time, we have the calming corner in the classroom, which was not a thing back in my days in school, but now you have a calming corner. You can go there, decompress, bring your thoughts together, and then express yourself. That's another thing. We stop students from speaking. We stop them from talking, expressing themselves. I remember as a little girl, my grandparents used to say, "Literature seen and not heard. Shut your mouth and go in a corner." And they do not allow you to express yourself. So you grow up being timid and not being able to express yourself and say,
Yes.
"Oh, this is bothering me," or "this is bothering me," or "I see this change," or "I see that change." A lot of times children were wrongfully accused,
Yeah.
and so forth. So we have to come to a consensus where we have to let each other express themselves. Listen, become good
gotta listen.
listeners,
You gotta
and
listen.
observe. Be observant. Be observant about your spouse. There are things only you would know about your spouse. There are things.
So
only
how would you
would
not
know
notice that this woman
about
walking with a
your
limp?
family, right? So be observant. You got to pay attention, and if you're not paying attention, ask questions. Do
Yeah.
not let things go unanswered. Ask questions, find out, and so forth. Those who need help, seek help. Do not sit and do not know, and then you just keep pondering and pondering and pondering and pondering. We sit every day. There are lots of women who sit in situations where their mind is not there. They don't even know what day of the week it is. They're just going through the motion and so on. That is not healthy. That could never be healthy. And if you say, "Oh, I'm gonna stay for the children," children get big, they leave and go and start their own life. And then also, what are you teaching them? You are not teaching them to stand up for themselves. You're not teaching them to speak out. You're not teaching them to ask questions and inquire. You're just teaching them to withdraw and sulk. So it's an environment now we're creating where we are not, even if we don't sit and talk, sometimes our actions speak louder than our words. And so the students are and our children are looking at us. And so whatever we portray, that's exactly what's going to happen, right? So definitely we have to get our men being a little bit more involved. There are some men that are involved, but also we have to also have the women be a little bit more open. We're always secretive when it comes to our body a lot of times too. You're very uncomfortable. It's not a topic that is easily spoken about in relationship. If they're having problems in the relationship when it comes to sexual interactions, it's not a topic you say, "Look, sit down. You're not satisfying me, and what is wrong?" And so that is not a readily easy topic for a spouse to have. From the time it might start, things usually go left, right? So you got to know your partner. If you got to get a mediator, if you got to go to someone and these kinds of things, we have to try and ensure that our health is what matters. The health of your partner, the health of you, all of it matters, because at the end of the day, we need to live with each other. And it would be so unfair to know that something detrimental has happened to you and you haven't shared it with your partner, right?
And friends, let me tell you something about friends. Friends is another thing. You have to be the friend that can pull your friend in a corner and say, "Your mouth smelling. I've been noticing you're getting an odor in your mouth. I've been noticing your body odor is getting stronger. I notice when you pass by, I gotta be that friend." Because you could be saving that friend's life. Some of us walking around with illness and sickness and we don't know. And we got people around us that are not saying anything because they're frightened that it's gonna hurt your feelings. Again, we weren't taught that in school. We weren't taught how to regulate our feelings and how to deal with our emotions. But you be that friend. I am that friend. Even if my friend vex with me, I don't business. Because I'm not coming from a malicious space. I'm not coming from a space to embarrass them. I pull them in a corner and say, "Listen, friend, Your mouth? No. Your armpit, whatever. I had a friend that all we used to together, we performing all over the place together, and they susu. What we talking about? Oh, we talking about so armpit. I start to ask questions about what you could do with armpit, and then I pull home girl in the corner and I tell her, hey, get some lemon, get a hot tennis roll, all of these different things I hear to put on your pits. Because you're a beautiful young lady, and pull she by herself and I talk to she. It's show buy perfume and right deodorant and all kind of thing. And then when she stops smelling, we ain't hearing from them. But they're running the mouth. We ain't hearing them complimenting how nice she smell, but we're hearing people running the mouth. We have to be the one friend who is going to pull your friend in a corner and tell you, this is what I noticed. You have no idea. People are dealing with, what you call the thing with the mouth? What is it? Halitosis?
Gingivitis.
Gingivitis and them thing. You see them in the green and all of this tick plaque. Hello. I always, do you know what a tongue scraper is?
Yeah.
They got people walking around here with thick mass on the tongue because they brush the tongue for 2 seconds. Do you know what a tongue scraper is? Get your tongue, good tongue, scrape and scrape your tongue every time you brush your teeth. I teach my son that. You have to floss every time you brush your teeth and every time you finish eating. Yes. And we don't play that in this house. You understand me? Certain things that have people growing up and don't know about how to carry their bodies. You understand me? And a little thing like bad breath could turn off. You Prince Charming could stand up right there. You go up your mouth and block you out. Hello, who are you?
Well, that's why education is the key. Yeah.
And it starts from home. We are our children's first teacher. We teach them, say mama, say dada. Why we stop when they start going to school? Is the teacher's responsibility? No. It takes a village. We now become a part of the crew that's going to raise this human to understand how to deal with if they're feeling sad or upset. And I hear about the gentle parenting. Me don't gentle parent. I'm not gentle parenting. I speak to my son like he's a human. I ain't doing that. No. Use your words. Excuse me. Speak and speak clearly so I can hear you. No, baby, what we're going to do, we're going to use our words. No, we're not going to throw things. No, we have to do better when it comes to raising our humans that's going to take over this world later on. We already had enough going on. You see all the hate? Do you see all the hate that is out there towards the different races? Because no emotions were regulated. They teach your children how to take care of themselves. It's Women's History Month. We're closing out the month with beautifully. Please, I beg of you, women, men, everyone. We have the young ladies, traveling around and going to school. They're getting boyfriend early and all of these things. Teach them how to take care of themselves. Teach them about panty liners, teach them about bras, teach them how to wear deodorant, teach them how to wash their bodies, teach them to understand how to check themselves, even when they're in public, even down there. It comes up. Once the smell start coming through, hey friend, this is the last stage. Once your smell start coming through your blouse, that's the last stage. It shouldn't reach that far. You understand?
Yeah, there's a comment in the chat from Yolande. She says, my mother has one leg because she had a sprained ankle and not taken good care of it for years. She had poor blood flow, and I had to force her to go to the hospital by telling her if she doesn't go, I would not give her anything anymore. So I'm assuming as a result of that sprained leg and bad blood flow, part of the leg had to be amputated. And thank God for tough love. If she didn't reinforce or enforce that, she might not have had her today. At least she has one leg, but she still has her.
Still have a life. That's right.
And that's so forth.
Sometimes you gotta show family tough love.
Well, we had Kendra, we had guidance counselors back in the days in our primary school. we had guidance counselors, and
Mhm.
we used to go. Sometimes the teacher take us out in the class all by ourselves, boys and girls, and we used to had a chance to discuss anything. And
Separately.
on the note that Leslie mentioned earlier, of we all know charity starts at home, but then we have some young mothers, and some young fathers who do not even understand the basic principles of life, and
Yes.
like they need to be taught also. So, like I said, like Sister Jamila Jacobs just said, it's about education, and we all know education has value when it is established in persons of good character and respect to God. So, I am so happy being a part of this platform and all the information that is coming out. I do hope it don't fall on deaf ears, because all those who listening,
Yeah.
Yep.
take note, and
Yeah.
we can make a change. And
Mhm.
I'm thankful that the GG show is here, bringing it to you.
Yes.
Share it to all platform and
Mhm.
let it reach people, because we are teaching. We are bringing awareness
Yes.
to each and every one of us. I'm learning. I'm sitting here. I'm thankful. I'm learning a lot. I'm still
Yes.
learning. I'm a humble child, and I'm thankful. I'm thankful, and I love you all.
Yes.
Thank you.
Yes.
Thank you so much.
Even though we're women, we still learn things about our bodies every day.
Every day.
Yep.
Every day we are still learning things about our bodies. And so, there is so much changing, right? And a lot of young people, um, they get into sex early. And a lot of times when they start, I mean, it's the hardest thing to get them to do, to say, "Oh no, don't have any sex, abstain," or whatever, whatever. But I think if we be frank with them and let them know that, listen, not only can you get pregnant, you know, you can contract this, you can contract that, you can make this happen, you can make that happen, which can result in this, and you lay it out for them.
Yeah.
Yep.
Give them that knowledge. Be frank. We try to shade them too much. You
Yeah.
know, they want to be out there in the world to do the things we're doing. Then give them the facts about the world out there.
Yeah.
Knowledge.
A
Knowledge.
lot of them are not afraid of HIV anymore, which is really sad.
Wow.
They're not afraid of it anymore. They're out there having unprotected sex all over the place. And it's
Yeah.
not just HIV. There's so many things that you can develop. Like Kendra just said, there's so many STIs and STDs out there. You would
Yep.
not believe it.
Yep.
Yes.
I give myself. I don't play that. I'm raw. Okay. I am one of those mothers who are raw. Cause like I said before, my mother just told me, okay, now you have your period. Don't have sex because you could get pregnant. She didn't tell me about anything else. I had to learn that my way.
Yeah.
Thank God I
All
didn't
right,
get
Miss
pregnant
Jamila.
or any of it. Yeah.
Yes, Miss
Mr.
Jamila.
I want to add to this, right? We have to be the change. Be the change for changes.
Yep.
Don't be the change from a dollar bill that leaves 50 cents. No, be the change. Be the change.
Yes. Yes. DJ Harley Quinn, you were saying something. I know you're in audio.
Was I? I don't. Yeah, but if you give me a chance, I would talk about this because I got lived experience when it comes to do with menopause.
Go ahead.
Yes.
I've had to deal with folks get up late at night and just walk around the yard, just those kind of things. So I've been there, known that, share those experiences and support one way or the other. But before we get into the close, I want us to know that we hear a lot of stories about people who hid their illnesses, and invisible illnesses, we all can agree, deserves visible support.
Yes.
So in the instance where people hide and not tell us, we still need to do some visible support and do our part, as Lady rightly says, to educate, to follow the pain long enough to bring about the change that we want to see. And so I
Yes.
would say in my closing, invisible illness deserves visible support.
Yeah.
Mhm.
Well,
Wonderful.
yeah.
Yes. Winston.
I just want to say thank you all once again for having me. All of us here, we are happy. We're excited. And I just want to know that, you to know if you have any events coming up, you can advertise with the Gigi Show. Just make contact with myself and whichever the panelists, and we're going to be advertising your upcoming events. Thank you.
Yes. Leslin?
Before I give my take, I have actually no, let me give mine. First, and then I have something here I want to read from Gigi. She wanted to give a message before we close out. Look out for each other. Pay attention to the signs. Go get yourself tested. The first step to healing is acknowledgement. You have to know, you have to acknowledge that something is wrong with you so you could get checked. Stop with the, I got a migraine. You know where does migraine come from? Stop walking around with a headache for 12, 5, 15 months. Pain in your back, pain in your leg, pain in, you feel wrong, you go to the doctor. Some of us wait until we're sick and can't move and dying, then go to the doctor. Stop that. You have children, you have grandchildren, you have so much to give to this world. You can give one advice to somebody that could save their life. And you're out here walking around dying and not telling people. Stop that. Say something. Be the change you want to see, according to Miss Jamila. Okay?
Yeah.
We have to speak up and get ourselves tested. Men, women, once you pass the age of 40, go get your colonoscopy. I don't want to hear Drayton that back there. I know you have something to say about going to get the colonoscopy checked. Go get a colonoscopy. They ain't putting no object in on you.
Call him out, Leslin. Call him out.
You understand?
Leslin,
yeah.
Leslin, one more thing on that note. Sorry to interrupt.
That's okay. It's all right.
I have noticed people in Guyana going to the pharmacy instead of going to the doctor, and that's a serious issue.
Before I go buy some tablets.
I witnessed it, man. I can go to the pharmacy and collect and
buy
get
two couple black and red antibiotic.
And that is dangerous.
Yeah.
That's dangerous.
It's called putting a band-aid. Putting a band-aid
on a gunshot wound
situation.
Yeah. That's what it is. Yeah. That's what it is. Go get yourselves checked. Get your colon checked. We have people are dropping from colon cancer.
Yes.
One time. If you do it now and it's clear, you don't have to do it back in another 3 years. Get it done. I beg of you. Women, go get your cervix checked. A pap smear, it lasts about 5-10 seconds. Open, swipe, done. It's not an hour, it's not 20 minutes. They take a swab, they swipe it. That's it. That's a pap smear. It's smear, and that's it. There's nothing to hurt you. Oh my God, I can't live. No. Get it done. Do your mammogram yearly, ladies. I beg of you. Okay? Your bodies change yearly. As the older you get, your body changes. You have to adjust to it. You have to adapt to it. I just had this fan on. My hot flashes come every 20 minutes. But I'm surviving. I'm here. I'm alive. At first, it was driving me crazy. The itching of my body and all of that, the ears, all of that. But you adjust. That's what life is about.
Cold bath doesn't help. Cold bath don't help without flashes. I'm just asking as a man.
Yeah, but the cold bath is just temporary. When you come out the shower, 20 minutes later, your body hot again. You can't bathe every 20 minutes.
It's
a phase. It's a phase.
Kendra, I'm in the 3rd year. What are you talking about?
Leslie, you gotta have a whole.
It's a phase.
Can we have a whole show?
Who went through and done.
Ladies, can we have a whole show to discuss that particular subject with the M?
For sure.
You know, right?
For sure. Okay, so my words.
Let's Miss Jamila. Do Miss Gigi's report you do last. Yeah.
No problem. Miss Jamila, you go.
Yeah, well, I'll just thank, and I call Gigi my Gigi. Thank you, my Gigi, for having such a wonderful and beautiful program. I hope that our listening audience, someone learned something from this wonderful, beautiful program. Because when we deliver such a teaching mechanism, we want the listening audience to have the aha moment whereby they learned something, because each one have to teach one. So I am so grateful and honored to be here in the midst of all of you wonderful educators. Thank you.
Thank you. Thank you.
Thank you. Yes.
Thank you so much.
So our beautiful Gigi, I should say creator of this show and the namesake of the show, has sent a beautiful message to all the women in keeping with our Women's History Month. So I'll now ask Leslie to do that before I do my closing.
Okay. All right. From Gigi to you guys. Empowering words for the woman of the close of Women's History Month. For women, celebrate strength, resilience, and equality. She's encouraging women to recognize their worth and to break barriers. She wants you women to foster confidence, unity, and unapologetic ambition to create lasting change. All right? Go out there and be yourself. Know your worth. Strive for what you want in life. Love your life. Take care of yourselves and be good to each other. Happy Women's History Month from the host of the Gigi Show, the one and only Gigi George. Thank you guys for watching the program. Thank you for tuning in every week. She love you guys very much.
Yes. Now, finally, I would like to say thank you, Gigi, for that wonderful expression of kind words to our women and our listeners. I would like to say a special thank you to Dr. Arnold Sparman, who's living in Guyana and got blackout, who we know about.
Yeah.
That's why she came off. She got me a message and said, Kendra, I just got blackout. So thank you very much, Dr. Arnold Sparman, for joining us. And also, I'd like to say a special thank you to Dr. Farah Kasim, who is a medical specialist in that is northwest of England. And she has her own practice. She is responsible for a lot of the information that I got tonight and the images that we showed. So I want to say a special thank you to her as well, because we want to ensure when we're divulging information, we are giving you things that are factual, because, you know, we're not authoritative on those things. So we want to ensure that when we're divulging that kind of information, they're coming from authoritative figures. Thank you again, audience, for being a wonderful audience again. And please, the takeaways are: ensure that we're doing our pap smear, ensure that we're doing our mammogram, check if you got your HPV vaccine, or if you do have it and it is low, you will need to retake it.
Yeah.
And ensure that you do. Also, if you notice the discharge got different colors, do not be a Facebook doctor, a Google doctor, or ChatGPT doctor. Go and find out, because discharges have different meaning. We do not know. We didn't study it. Go and get the information. And last but not least, as my friends would say, let us ensure that we're detoxing. Because when we do these things, we eat healthy, we detox, and so forth. We be very observant of our bodies. And we also have to be shareable, as my friend Doggy would say. Shareable things, if there is such a word. But what I'd like for you to know is that you need to come to a place where diagnosing or giving your diagnosis to your loved ones must not be taboo.
Yeah,
that's
They
right.
must know. Tell them, right?
Mhm.
Tell
Mhm.
them, because they're gonna notice. If you get a certain odor, they will know. If something looks different, your breasts change color, they will know, right? So we gotta ensure that we are sharing, caring, and being supportive. So thank you again. and have a wonderful rest of the evening, everyone. Goodbye now.
Thank you. Thank you so much.
Bye, everybody.
Bye.
Thank you, guys. Thank you, Ms.
Life doesn't always go as planned. There was a time when everything felt lost. No home, no direction, no certainty about tomorrow. But even in the middle of the storm, purpose was being born. This is more than a story. It is a journey of rising after the fall. From homelessness to hope. From struggle to strength. Purpose in the storm. A story of faith, courage, and rising again. Get inspired, get strengthened, get your copy today.